Professor Tan Chaw Chuan, President, National University of Singapore, Professor John Wong, Dean, friends and colleagues. Welcome to the top conference. About 6 years ago, a few professors of psychiatry from the ASEAN countries, including Professor Hussein from Malaysia, Professor Sasanto from Indonesia, Professor Piche from Thailand, and Professor Tan Chee-Hoon and I, we plan to meet here in Singapore to discuss issues of curriculum, exams, and research collaboration. But because of the scepter of SARS, we had to shift down to Australia, and we were hosted by Professor Edmund Chui. Since then, this grouping has grown, and we have formed a club. It's called the Top Club, or Teachers of Psychiatry Club, with a tagline, Psychiatry Sans Frontier. Today, I'm glad interest has grown beyond ASEAN countries, and we have participation from other Asian countries like Japan, China, India, and also from North America, Europe, and a large contingent from Australia. And as I stand here and view the audience, I'm impressed and overawed by the brain power in this room. We have some of the leaders of psychiatry on the planet in this very hall. This conference is supported by the Pacific Rim College of Psychiatrists, and the president, Professor Noda, is here. We're also supported by the Royal College of Psychiatrists in the UK, and the president, Professor Dinesh Bugra, is here, together with the chairman of the Western Pacific Division of the Royal College, Emeritus Professor Scott Henderson. We also have the support of the Asian Federation of Psychiatric Associations, and the founder member, Professor Deva, is sitting in the front row. When the conference ends tomorrow evening, it will be followed by a 4-day workshop on training young psychiatrists for future leadership. And this workshop has been organized by Professor Norman Sartorius, who is the former director of mental health of the World Health Organization and the past president of the World Psychiatric Association. Psychiatry is not just for the psychiatrists, and in this room we have many family physicians, psychologists, social workers, and over the back row I see a few medical students and students from the Ellis School of Nursing. Psychiatry is also no longer just been taught in the mental hospital, and in the general hospital the focus is not just on schizophrenia and bipolar, but also on the psychiatry of oncology, cardiology, family medicine, and emergency medicine. There is some lamentations that psychiatry has become too biological, and we tend to teach our doctors pharmacotherapy or drug therapy and ignoring psychological therapy, which has often been outsourced to other health professionals. Psychiatry is not just about the brain and the mind, but also about the person, and I think we have to emphasize the centrality of personhood. Early at lunch, an hour ago, one of the overseas speakers told me that he was quite impressed with the achievements of our department and wanted to know something about our department. Our department is small, with just 5 academics and 7 clinicians, and we are just about 30 years old. We have a few achievements. We're one of the few departments in the university to have won a world prize in the World Research Competition, our paper on dementia. We're also the only department in the university to have been invited by the United Nations in New York to participate in a World Forum. The forum was on mental health. And we're also the only department, I think, in the Faculty of Medicine to have a paper which has been cited or mentioned in the Times of London and the New York Times, our paper on turmeric and curcumin to slow down cognitive decline in the elderly, a paper by Professor Ng Zipin et al. And although we are just about 30 years, the history of psychiatry in Singapore is over 100 years. And it probably started in 1819 when the British East India Company set up a trading post here on this island. And the colonial administrator, Sir Stanford Raffles, licensed the sale of opium as a commodity for trade. And he ensured a career for Professor Mooney Winslow, a professor of addiction medicine. In 1905, when the medical school was founded, the first dean of medicine, a certain Dr. Freer, the gentleman, the top left-hand corner there, a Scotsman from Edinburgh, took office and set up office in a building which housed the mental patients in the general hospital. The patients were evicted and sent to a home somewhere along the south coast. To this day, whenever the dean rings me and tells me he wants to visit our department and wants to look around our real estate, I'm always very worried. In 1928, the huge cavernous mental hospital, Woodbridge, was built with a capacity of 3,000 beds. And it was there that psychiatry was taught for over 6 decades. I was the CEO and medical director and tried to downsize it to about just 2,000 beds. 1977 was a momentous year in the history of psychiatry because in 1977, the British General Medical Council sent a delegation to Singapore for the accreditation of the medical school. A member of the delegation was Professor Neil Castle, who was the professor of psychiatry in Manchester. I was then working in England, and I heard of this visit because Neil Castle's registrar, an Irishman, is my good friend, and he told me that the delegation was very impressed with the teaching of medicine, surgery, and pediatrics, but they were dismayed there was no department of psychiatry. The dean of the day was Professor Edward Top, and he responded expeditiously. In 1979, the department was formed, with Professor Soy Wing Fu here as the first head of the department. And since then, the department has grown. One of the KPIs, the key performance indicators of every department in the university is research output. And we've done fairly well in 3 areas: schizophrenia, addiction, and aging. On schizophrenia, Professor Soy and I, we have conducted a 20-year follow-up study of schizophrenia. The data has been published in the European Journal, and we were surprised that the outcome was better than North America or Europe. And also on the neurobiology of schizophrenia, one of our colleagues, Professor Tan Hao Yang, sitting down there, our prodigal son who just returned, has made new discoveries in the glutamate story and has paper published in distinguished journals like Molecular Psychiatry, PNAS, and the Journal of Clinical Investigations. On addiction, we have several papers of relevance to Asia, and one paper that was published in the British Journal, I'm told is the only paper in Singapore that has been selected for discussion in a journal club in NIH. And in aging, in 1988, when Professor Sartorius was the director of mental health at the World Health Organization, the World Health wanted to conduct a global study of dementia. Our department was selected, and we published one of the early papers on the epidemiology of dementia in elderly Chinese and Malays. That was 19 years ago. In aging, we have also other papers in distinguished journals such as JAMA, the BMJ, and last week, Dr. Roger Ho had a paper in The Lancet. And although we have other important papers, I'm most impressed with one project which we did, which involved many agencies around the island. And it's a form of translational research. Whatever we found from research was translated to information of relevance to improve the quality of life of elderly people. Sometime in 1999, I was a research fellow at NIMH, and NIMH wanted to publish a book on elderly suicide. I was tasked with gathering the data for Singapore, and when we compared the data across the world, we were taken aback. The suicide rate for old people in Singapore was the second highest in the world. The Minister of Health obviously was very concerned. I had many discussions with officials, the Ministry of Health, the Ministry of Community Development. We also involved many GPs, Professor Goh Ligan's team, and also agencies in the island, notably the Singapore Action Group of Elders. At the time, the president was Dr. Lim Chan Yong, and the various organizations like the Gerontological Society with Dr. Henry Lim and Mr. Lawrence Wee. And we track the suicide rate every year in Singapore from 1995, a high of 62 per 100,000. It dropped every year till about 12 years later was 15 per 100,000. This is a marvelous achievement for Singapore and a feather in the cap for the department. 3 years ago, I was asked to give a lecture in Chicago, and the chairman of the symposium, the professor of psychiatry at the Mayo Clinic in Rochester, told the audience that he was very pleased that Singapore has brought down the suicide rate, something they have not done in North America. The success of any department hinges not just on the researchers, but also on clinicians and clinical teachers and the administrative staff. I want to thank the members of my team who helped to organize this conference. This conference is being organized on a shoestring budget. Frankly, we don't have the finance to host this conference in an expensive hotel in town. However, I believe in this time of an epic economic crisis, it is important to maintain or observe financial prudence. And I also believe that an international conference on specialist training in psychiatry or medicine is best held on the ground, the hallowed ground of a university.